Buenas tardes. Thank you, everybody, for being here. My name is Maria Cardona. I am a principal at the Dewey Square Group. I am a political commentator on CNN and CNN Español. But my most important title is very good friend to the NHMA, very good friend to Dr. Elena Rios, and somebody who always does what she asks me to do, which is probably no different than a lot of people in this room, right? Thank you. Welcome to Washington, D.C. This is a beautiful time to be here in the city. It's cherry blossom time. It's a little bit colder than I think people would expect around this time, but we've had some wild weather. I'm sure everyone has been a victim of that in one way, shape, or form, but we're glad to see you here. We're also very glad that you're here for this wonderful conference. I have been honored to be a part of this conference in many ways for the past several years, and it's always an honor to meet all of the doctors and healthcare workers who take care of our Latino community. You all really are at the vanguard of keeping us healthy, of keeping us strong, and of making sure that the Latino community continues to contribute solidly and sustainably for a very long time to come. So I want to give you all a round of applause for everything that you do. And we're just always so proud to see all of our Latino doctors, residents, and medical students, our federal and private sector leaders, to support this very important topic that we're going to be talking about today. And the topic that we're going to be talking about today is the National Hispanic Lifestyle Campaigns. The focus of today's lunch is to become informed, to become better educated, so that we can teach others within our local communities how to live healthier lifestyles, how to make smarter choices. Information is power, and we want to make sure that every single Latino and Latina, especially ones who have small children, have that power to be able to make healthier choices for their families. So we're going to hear from our federal representatives from the Office of the Surgeon General, from our sponsors, the Coca-Cola Company, as well as from the NHMA member of the Board of Directors in her role as leader of the NHMA Child Obesity Campaign, supported by the W.K. Kellogg Foundation. I'm not going to go into the humongous biographies of every speaker here because that would take the whole hour of the lunch. So you have them in your program, so I would just suggest that you take a look because these are some amazing speakers that you have today, and it really does merit you going back to see and look at what their backgrounds have been. So here to introduce our keynote speaker, which we're very excited to hear from, is our fearless leader, the NHMA President and CEO, and my dear friend, Dr. Elena Rios.
It's an honor to be here and welcome you back to our National Hispanic Medical Association 19th Annual Conference. And we are so proud to have with us today the leadership for doctors in the United States, our U.S. Surgeon General. Before I introduce him, I just wanted to make one statement, and that is the theme of our conference this year was to have effective strategies to improve the health of Hispanics in our local communities. And what better local community strategy than to have more Latino doctors and residents and medical students understand their role as leaders of their communities, whether you are in private practice, clinics, hospitals, in academic faculty, or working in our public health departments, or administrators for our insurance companies and pharma companies in our local communities. Many of the doctors here also provide advice on advisory committees to corporate sector, and we really understand the importance of public-private partnerships, but it's all because our mission is to improve the health of Hispanics and to empower the Hispanic physicians to do that. We formed this organization back in '93 at the White House when we decided that we had to provide the federal government a way to find us. We know how few, there are only 5% of the Hispanics in this country, doctors in this country are Hispanic. We know how few of us there are, but we know that if together we can be stronger and have a voice for the nation and link back to our local communities. So I just want to introduce that concept of that we are the leaders, and we're here to be informed on lifestyle campaigns, not only from our Surgeon General, but from Coca-Cola and from the Kellogg Foundation. And these are public-private lifestyle campaigns that we all need to be informed about. So Vice Admiral Vivek Murthy was nominated by President Barack Obama in November 2013 and confirmed on December 15, 2014 as the 19th United States Surgeon General. And as America's doctor, he is responsible for communicating the best available scientific information to the public regarding ways to improve personal health and the health of the nation. He oversees the operations of the U.S. Public Health Service Commission Corps, comprised of approximately 6,700 uniformed health officers who serve in locations around the world to promote, protect, and advance the health and safety of our nation. And I just want to say that he is the nation's doctor. We're very proud to have him, and let me bring him up.
Thank you, everybody. Thank you. Thank you so much. Thank you. I first want to thank Dr. Elena Rios for that wonderful and warm welcome, for having me here today. And I also want to thank the organization for the tremendous work that you've done over the last 19 years. During my career before I was a Surgeon General, I had the chance to do some work with NHMA and have been an admirer of Dr. Rios for long before I was in this position. So it's especially nice to be here with all of you. And I also want to thank all of you for the work that you do every day in caring for patients and advancing public health, especially around the issues like obesity, substance abuse, chronic disease, issues that are of great concern not only to the Hispanic community, but to all people in America. And I know that you've talked a bit about this already in the earlier parts of this conference, but this is something that we need to keep talking about because these health crises are important for all communities. I want to say on a personal note, though, that it's especially nice to be here with healthcare providers, with doctors, with medical students, with others who are charged with taking care of individual patients while also thinking about the broader health system that we're focused in. And I know that for many of you, as it is for doctors across this country, that your work is not simply something you do to get a paycheck, but it's part of a larger calling that you have. It's part of a mission that you've taken on, and it's a responsibility that you understand to really take care of not just individual patients, but people throughout the country and throughout the community. So I thank you for that, for the responsibility you've undertaken, for the service that you do every day. And I'm very excited to see what we can do together in the months and years ahead with NHMA, with the Office of the Surgeon General, to advance the interests of all populations in the United States. My own start in public health came a long time ago. In fact, my interest in medicine and in public health began when I was actually just a young boy. My parents left India in the early 1970s. They traveled to England, to Canada, and eventually ended up in Miami, Florida, which is where I grew up. And you know, it was an interesting experience growing up in Miami because all my friends were either of Hispanic origin or Jewish, and that was what was my joint identity as a kid growing up. So it was very odd for me to go to college and not hear Spanish being spoken all around me. Every time I go back home to Miami, it feels like home. And every time I'm around Spanish speakers, it reminds me of the friends and teachers and others I had growing up. So it's a very important connection for me. But growing up in Miami, my family, we didn't know anybody when we first moved there. We didn't have a lot of money when we came, didn't have many connections. And this is a story that's very familiar to immigrants of all backgrounds who have come to this country. But what we didn't have in terms of resources and connections, we made up for in passion and our willingness to work hard. And my father is a primary care doctor. My mother is not a doctor by training, but she worked very hard with my father to build a medical practice that they ran when I was a child. And my sister and I did what any kids would do in a small family business, which is we helped out in the practice. So we spent afternoons there after school. We spent evenings and weekends there helping sort the mail, helping to clean, helping to answer the phones, helping to do the things that you needed to do to keep an office going. And one of the things that we didn't expect to encounter during that time was an appreciation for the kind of relationships that my parents were building with patients over time. In the beginning, we didn't really fully understand these relationships. To us, they manifested in the Christmas gifts that we saw under the tree, every winter. And I still remember some of those gifts. There was always a large bag of pistachio nuts that my father would get from one of his patients, a patient from Colombia, actually, who would always, he just gave it to him every year, and we would spend between Christmas and New Year's eating pistachio nuts. And then there was also the gift which I remember, which was a life-size solid chocolate foot, which we would give. And it was literally in the form of a foot. And my sister and I would spend between Christmas and New Year's chipping away at the foot and eating the chocolate. But this is what doctor-patient relationships meant to us as very small kids. But as we got older, we came to see them in a much broader context. We came to see the kind of relationships that my parents were building, and that they were not only helpful to patients, but they were also therapeutic for my parents as well. And I remember one night when I was very young, being woken up in the middle of the night by my mother, who shook me and woke me up and told me that we needed to get in the car and to leave right away. And I was confused. I didn't know where we were going. But she put my sister and I in the car, and she and my father began driving us to a trailer park in Miami. And during the ride over, she explained to us that one of their patients, his name was Gordon, had just passed away from a smoking-related cancer. And they were worried that his wife was going to be grieving alone. And so they didn't have any babysitters or anything at that time, so they just drove all of us to the trailer park in the middle of the night. And I still remember the image of my mother dressed in her traditional sari, like walking up the steps of Gordon's wife's trailer. Her name was Ruth. And I remember the image of her stepping outside, I could see her face in the moonlight. And I remember my mother hugging her as she cried. And that image stuck with me because it reminded me that what my parents were doing, what all of us do in healing, is about much more than writing prescriptions. It's about much more than making diagnoses. But it's about establishing relationships of trust with people. It's about understanding who people are beyond their diagnoses. It's about understanding where they're from, and sometimes going to where they are to understand that and provide the care that they need. That's what my parents taught me, and that's what inspired me to go into medicine in the first place. And over the years, I had the opportunity to get started in doing public health work, actually from very early on. And this I also credit to my family. My grandfather, who was a poor farmer in a small village in India, he didn't have much money either. His wife died of tuberculosis, my paternal grandmother, when my dad was only 10 years old. And so my father raised 5 other siblings while spending part of the day in the rice paddy fields, cultivating mangoes and tamarind and coconuts as they did, taking care of the farm animals. But his father, it was very interesting. His father, my paternal grandfather, spent a number of months out of the year traveling around to different villages, raising money to build a youth hostel so that kids would have a place to stay when they were in college. And people used to ask him, they said, you're crazy. Why are you doing this? Your family doesn't even have enough to eat. But yet you're spending a few months out of the year traveling around raising money for other things. Don't you have your priorities messed up? And what he would always say to them is he said, as little as we have, that there are always people who have less than we have. And it's our duty to do what we can, when we can, to help them too. And I remember that lesson because my father would tell that to me time and time again. And as my grandfather would say, his only desire for his kids and his grandkids was for them to be good citizens. And what he meant by good citizens were people who, when they saw a need around them, that regardless of how difficult or easy it was, but they stepped up to meet that need, to do what they could. And so with that guidance, with that moral compass that he established for us early on, my sister and I began our first efforts in public health when I was 17 and she was 18. And we did it through building a nonprofit to address HIV in India in the early 90s, at a time when HIV was on the rise, but many people didn't want to acknowledge it in India for cultural reasons, for other reasons. And we went on to work on other public health endeavors. We built a community health worker model in rural areas in India. Later went on to work on improving public health through technology that would be applied to accelerating research and clinical trials. And had the great joy of working on a number of other projects in between, but most recently building Doctors for America, which is a national grassroots advocacy organization, which has been very proud over the years to partner with the National Hispanic Medical Association in working to expand coverage, to improve our delivery system, and also to advance prevention. But more important than the individual activities was what I learned from these experiences. And the most important thing I learned was that even in the most challenged of communities, even in the most under-resourced settings, that there are people who have just given a little bit of support can make an extraordinary difference in their community. But often they're not given the chance, or people don't assume that they can't do much because they don't have resources. But I saw this time and time again, whether it was on college campuses, or whether it was in rural areas in India, or whether it was in urban centers here in the United States. I saw people step up time and time again to do unexpected things with innovative ideas to help meet the health needs of their country. And I saw this a lot actually in the last few weeks alone, because after starting my tenure as Surgeon General, I decided that I wanted to begin with a listening tour, going to small towns and big towns across America to understand firsthand what the real needs were that people were facing, as well as what they had tried that was working and not working. And at this point, I believe we've traveled to somewhere around 23, 24 cities, across the country, and heard a number of very interesting things. One of these is that we've heard about the concerns that people have in terms of illnesses. And people are very concerned about the obesity epidemic, which is affecting all segments of our population, although certainly some more than others, and particularly among minority populations. People are also very concerned about mental health and our challenges both integrating mental health services with traditional services, as well as our difficulty funding ongoing and robust mental health services. And people were very concerned about substance abuse, about the challenges that we face, not just with the old enemies, but also with newer products, with e-cigarettes, with other substances where we sometimes know that they're not helpful, and in other cases are uncertain whether they're helpful or harmful, but we see rapid use that is far outpacing our scientific understanding of the impact of these substances. So I heard about all of these things, but I also heard about innovations that people were undertaking. And the things that people were doing, which seemed to be having an impact, generally fell into three categories, which I wanted to share with you today. One of those categories were interventions that addressed healthcare needs early in the life cycle. So these were interventions that focused on kids and that focused on pregnant mothers. I remember one of these programs in particular, which was a Healthy Chefs program in Roanoke, Virginia, that we came across. And in this program, they had realized that there was a growing problem with childhood obesity, a problem that we see across the population. But they realized that we need to get kids to like fruits and vegetables. And the question is, how do you do that? What they recognized in this program is you need to do more than tell kids eat fruits and vegetables, but you have to show them what fresh fruits and vegetables look like. You have to allow them to taste it. And then the last piece is you need to allow them to do something with it. That means prepare something dish with the fruits and vegetables. So that's what they did. In the beginning of their program, they would ask kids, what are your favorite foods? And they always got the big three. And I'm guessing you can probably make a guess at what those big three are. But they included hot dogs, pizza, and macaroni and cheese. Yeah? The big three. But the good news and the interesting news was that at the end of these several weeks of teaching kids about vegetables and fruits and having them prepare various dishes with it, they asked them the same question again. What are your favorite foods? and they found that the list had changed. That's not to say that the big three had disappeared altogether, but they, in many cases, been replaced by dishes that kids had tasted during that time. And this was very interesting, not just because kids' preferences changes, but what would happen is that the kids would then go home, and they would ask their parents for those dishes. And then the parents would then come back to the school and say, how do I prepare this kale dish? What is kale? Where do I get it? And the schools would then teach them. And they built this program specifically to include ingredients that were readily available and that were affordable in the area, which was critical. So this is one example of the kind of programs that I encountered. The second category were interventions that took care to where people are. One of the things that all of you understand so well, because of the role that you have played in delivering care, is that our clinics and our hospitals are not the ideal place to actually change the fundamental underlying determinants of care. Prevention ideally needs to start far before people come into contact with the healthcare system, at least the traditional healthcare system. And so many of these programs that we encountered on the road recognize that and try to take preventive care in particular, but also sick care out to where people were. And these are the community health worker programs. These are the programs that focus their efforts on creating mobile units that could go to schools and help teach kids about prevention while also administering vaccines and doing screenings for them. And the last category of interventions that we encountered were those that focus on building collaborations across sectors. So not just collaborations between healthcare organizations and nonprofits that focus on health, but collaborations with organizations which don't have health in their title, but which play an outsized impact on prevention and on social determinants. And these are faith-based organizations, employers, schools, other social organizations in the community, which have bonds of trust that they've formed over time with community members. Now, as important as these three categories were, we found that communities found pursuing interventions in these three categories challenging for the following reasons. One was funding. And funding, that sounds obvious, everyone has challenges with funding. But what they brought up time and time again was they said the current funding system, and there is money out there, right? We all know that. But the current funding system is set up to force sectors to compete against each other instead of collaborate with each other. So when we would bring people together for these listening sessions, they would look at each other and they would say, we're so happy to know the folks in this room. We want to work together, but we find ourselves competing with these organizations for grants. And can that change? The second challenge that they had was just how to get started. When we would go from community to community, people would often ask us. In Birmingham, they would say, well, what is Orlando doing to tackle obesity? We want to learn from them. In Ohio, a state which ranks 50 in the nation in African American infant mortality, I remember one of the health officials there saying to us, if you just pair us up with the state that is number 1 or number 2, we could learn so much from them. And that was true. So this challenge of how to start and how to share lessons across communities is one that individuals at the community level are grappling with, and a place where I believe we can help. And the last piece that they were struggling with was on how to convince the non-health sector that they actually had a role to play in health, how to convince the Department of Transportation or Housing and Urban Development or Commerce that housing could be a platform for health. And when it wasn't, that it in fact could actually contribute to illness, as we see so often with secondhand smoke in multi-unit housing platforms. So this was a challenge, but the more examples that we see, the more stories we can tell about how this is being done, the more momentum we can build both on a local and national level for these cross-sector collaborations, the more we're able to convince, and the better shot we have at making the argument that non-health sectors need to play a role in actually improving health. And that's why taking a lot of these lessons that we've heard on the road, and our vision at the Office of the Surgeon General, and my dream is ultimately to have a country where everything supports health, not just our clinics and our hospitals, but the design of our cities, what's taught in our schools, the setup of our workplaces, as well as the safety of our neighborhoods. And I believe that in order to do this, a key component of this has to be ultimately building a community that is anchored firmly in prevention and in equity. For our office, while there are many issues that we've heard about, from substance abuse to mental illness to obesity and tobacco-related disease, we will be putting our biggest focus on the issues of obesity and chronic disease and tobacco. And we're doing that because when we look at where the greatest costs are coming to our country in terms of lives lost, in terms of disability incurred, in terms of dollars spent, it's often in these areas, in the realm of chronic disease, and often that are related to obesity and to tobacco use. Now, as part of this effort, we have decided that we are going to take on a couple of strategies. One is to modernize how our office communicates with not just the country, but with the world. We have a great scientific product that comes out of the Office of the Surgeon General, but too often that information doesn't reach enough people. It doesn't go as far as it should. 40 years ago, people would look for mainstream messages that could get to the vast majority of the population, but it's no surprise to any of you that there's no mainstream anymore. But there are many streams of people who need unique messengers, unique messages, and unique venues through which those messages are transmitted. And that's what we are going to focus on doing, modernizing our communication. The second thing that we're going to focus on doing is building partnerships with community organizations on a local and national level, groups like NHMA and others, through which we can translate that information into real action. And that transition from information to action is arguably the tougher thing to do, but the more important thing at this point in time. A lot of this is aimed at really doing two things, though. One is making healthy choices easier, and the other is making them more desirable. And this comes to the two twin issues I like to think about, which are structure and culture. And structure and culture can be barriers to health, or they can facilitate health. But in terms of changing structure, if we want to make healthy choices easier, then we have to change the structural factors which make it hard to buy healthy food, which make it hard to walk in your neighborhood because you're worried about safety concerns, which make it hard to be active because you're spending a third to half of your time in a workplace which doesn't really enable or promote walking or healthy living. We need to change some of those structural factors so that we can make healthy choices easier for people. Now, we have to recognize, obviously, that ultimately each individual is responsible for the choices that they make. But with that said, we can all benefit if we make these choices easier. But on the other side, we need to make these choices more desirable as well. And as I have often thought about this, if I were to approach any one of you in this room with an apple and a cookie in either hand, and I come right up to you such that there's no structural barrier between us to your accessing one or the other, what makes the difference between the choice that you make, whether you choose the apple or you choose the cookie? Those are often based on factors that are not structural, but may be more social and societal. What have you been taught is a healthy thing to eat? What did you see at your home when you were growing up? What did you see, in your community? What do you see in terms of what your friends eat and drink? So these things all influence the choices that we make. And so to really change structure and culture, though, it's not easy, but it requires cross-sector collaborations, and it requires leadership from a local level. And this is where I believe all of you come in, because the role that you play, especially at this defining moment in health for our country, could not be more important. When I think about the importance of tailoring messages and messengers to the people that we're trying to reach, no one knows better than you that we need the right messengers, and that when it comes to reaching the Hispanic population, that hearing from Hispanic healthcare providers makes a big, big difference. I was doing an interview with a magazine the other day that was an Asian American magazine or publication, and they asked me, they said, what should it mean to the Asian American community to have the first Asian American Surgeon General? And what I said to them applies actually to all communities, which is I said to them that in a country as diverse as America, our government has to reflect the people that it serves. And that is also true when it comes to the healthcare workforce. That's also true when it comes to healthcare, which is that we have a growing number of Hispanics and Hispanic Americans in the United States of America. And I look at that as a blessing, because immigrants have been a source of incredible innovation, energy, and ideas throughout our history. That's part of who we are as a country. but that also gives us a responsibility to take care of them in the best way possible. And to me, that means, in part, ensuring that our workforce also reflects the diversity of our population. And that's why that your efforts to not only bring messages out to the community about health, to be those trusted messengers that we so desperately need, but also your role in helping to ensure that we are bringing more Hispanics into the healthcare workforce, that is essential, particularly at this time. The other role that I'm hoping that all of you can play, that is absolutely essential, is that of catalyzing partnerships at the community level. When we think about who can help bring local organizations together, who can help bring the departments of commerce together with hospitals, together with groups which traditionally don't think about health, I do think of all of you, because you are respected leaders in your community. Just being a healthcare provider, people understand that you are there as part of your mission, not just for a paycheck. So your voice has a lot of weight. And that voice can be used to start dialogues between partners which traditionally may not think about working together, but which are absolutely essential. And finally, you can help move our conversation forward in America from one that has been primarily focused on health care for much of the last several decades to one that is focused on prevention as well. If we focused as much on preventing illness as we did on treating it, we would be much farther along as a country. And if I could rewind 30, 40 years into the past and do a few things differently, that would be one of the things that I would do differently, is to invest more heavily in prevention. That's a message that's important, but one that you are uniquely equipped to take forward. And I'll share a final thought with you, which is that as we are thinking about changing lifestyles, as we're thinking about the cultural piece of it, your unique understanding of the cultural context is going to be helpful in designing messages. When I was talking to somebody about food the other day, this was a mentor of mine, he turned to me and he said, food is more than calories that you put in your mouth. Food is the love that your mother gave you as a child. And when you think of it that way, it makes sense that people have very strong emotional attachments to food, that they have strong emotional ties and cues that they link to food. But it also raises the stakes of how important it is to instill healthy lifestyle habits from a young age. And that's something that you can help families to do, that you can help individuals to do, and something that you can model as well. So as we look forward, I know that the challenges that we face are daunting. When we look at the stats in obesity, of which you are well aware, the numbers can be quite daunting. But what gives me hope, what gives me a reason to believe that we can overcome these, are people like you, are organizations like NHMA, which have brought people together, people who could be relaxing and enjoying a weekend at home with your kids, but are instead have come together here because you believe in something bigger, because you believe that you could be a part of making something bigger and better happen for this country. And that gives me great hope, because I know that over the coming years there will continue to be obstacles to us making the changes that we want on a structural, cultural level. But so long as we have leaders like all of you who are pushing us to think bigger, to act bigger, and to stay the course, then I have no doubt that we will ultimately build a country where everything is grounded in health, that is focused on prevention, and that creates a stronger population and a healthier nation overall. Thank you so much. Thank you so much.
Thank you so much, General Murphy. That was awe-inspiring, to say the very least. From your early focus on public health to your focus during your work as a doctor, your listening tours on all of the issues that Americans care most about, to your focus on the importance of what everyone in this room is doing and the potential to make sure that our focus on public health becomes even more understandable and important to our Latino families in the years to come. I think he couldn't have said it better. So let's give him another round of applause. I'd like to now bring up our panelists for the next session. Lilian, por favor. Dr. Flores, we'd love to have you up here, please. But before we commence, I do have a few housekeeping reminders for you. There is no disclosure of conflicts of any kind for the speakers here today. And you'll need to go online. Yes, NHMA has joined the 21st century. To submit your CME attestation. This information can be found in your program. And finally, please remember to fill out your evaluation forms. So without further ado, I'm going to bring up our first speaker, Lilian Rodriguez Lopez, who is currently the Vice President of Sustainability and Stakeholder Relations at the Coca-Cola Company. I am honored to be able to call her my longtime friend and colleague. We have worked together on many, many issues, and I know that in her various incarnations throughout her life, she has always had a focus and has always felt the importance of making sure that she does everything that she can to bring the issues of healthcare first and foremost and at the forefront of the Latino communities around this country. So Lilian.
Good afternoon. How are you all? I want to say that I was deeply inspired by the Surgeon General's remarks. I thought that they were some of the most thoughtful things that I had heard in a very long time. And I have this amazing speech that was written for me that talks about the various things that I want you to know. So what I want to say is this is really a conversation. And it's a conversation because I think if you look at my background, you will see that I used to be, and I still consider myself to be, an advocate. I met Dr. Rios several years ago because we lobbied the federal government very aggressively, including the White House, on the Affordable Care Act. And I also used to run a nonprofit in New York known as the Hispanic Federation, where I did a lot of healthcare policy and actually ran a network on health disparities. And I knew, and I reacquainted myself with Dr. Flores when she was sitting next to me because I had heard her speak in New York. But I don't think, she didn't remember me, but I certainly remembered her. So, you know, the issue of health disparities, health care, health of our communities is an issue that is very important to me. And because of that, I have to tell you, being up here very quickly, I have sat before the President of the United States several times in the West Wing, and I was more nervous about coming to talk to you guys. Because I understand the company that I represent and the issues that I represent and the public discourse that is going around this country as it relates to obesity and sugar-sweetened beverages and consumption issues and what each food and beverage company is doing to help be part of that solution. So I wanted to share that with you guys because I wanted to get the 800-pound gorilla out of the room. I am grateful to be here with you because every day of my life I have looked to empower the Latino community and I have looked to build those bridges. So thank you for having me today, and I want to thank Dr. Rios, and I want to thank the board chairman also, and I want to thank the entire board of directors on having this event and making it a very successful event. We are branded, and our company has always talked about refreshing the world and inspiring moments of optimism because the brand is associated with celebrations. But it doesn't mean, it also means we are not in conflict We want to create a positive impact on every community we touch. And that's why it's really important for us to work with registered dietitians and physicians and scientists and researchers, because we need to learn from you. We're not perfect, the solutions are not perfect, and we're looking for ways to make a difference and to be better as a company. We recognize that the communities and the people we serve are continuously changing, and we know that people want different beverage choices. And we know you want information as well on how to lead healthier lives, and we're listening. And I want to be real clear here, very clear. We do not position our products and say that they are healthy. We don't say they're unhealthy either. We watch and read and understand the science and the research, and we follow it and we care. But we're not saying it's a healthy product. What we are saying is that it refreshes you, it hydrates you, and it's a treat. And we want people to treat it in that way. And because of that, we are, and I know you've seen it, we're introducing the mini cans. You're seeing a lot more of the contour bottle and the 8-ounce bottles, which is what we produced for over 50 years, because part of my work and part of my portfolio is really portion control and moderation in everything we do. Now, I want to tell you about, thank you for those claps, I appreciate them. In 2013, we announced 4 global commitments, and we're in 200 companies, so we were putting a stake in the ground as a business operating in these 200 companies, and it followed commitments we had in North America, and I want to share what they are. They were to ensure that we were offering low or no calorie beverage options in every single market. That was the first commitment. The second commitment was to help get people moving by supporting physical activity programs in every single country where we do business. Third was to provide transparent nutrition information featuring calories on the front of all our packages. It meant you were no longer going to go 2.5 times X equal this amount in this bottle or in this can. And that we were going to market responsibly, that there would be no advertising to children under 12 anywhere in the world. We want to make sure that we're empowering consumers by providing the information, providing the choices, and opportunities for them to make the right choices for themselves and their families. And so together with the entire industry, we're leading with the products, the policies, and the programs to help reduce calories, encourage healthier living, and educate people on the importance of calorie balance. So we're taking action, and I want to describe to you some of the U.S. programs. Launched in Chicago in 2012, we did Troops for Fitness. Troops for Fitness supports the hiring of U.S. veterans to teach boot camp-style fitness classes to local families. The program hires those vets and has helped us promote active living in 14 communities across the U.S. Coca-Cola is also the leading partner of the Boys and Girls Club of America's signature active living and nutrition education programs. It's called Triple Play. Since its inception in 2005, over 10 years ago, Triple Play has made over 9.2 million connections with youth across its 3 program components. This is about really thinking about what you eat, you drink, and you do. We're also partnering, and I'm sorry that the Surgeon General stepped out, because part of our vision is also to do things that are sustainable. So right now, we've been partnering with local governments and community organizations on a new program known as Refreshing Community Spaces. It's a program to refresh parks, recreational centers, and other activity spaces in neighborhoods all around the U.S. It's a program that I'm leading with someone else at the company, and you have sustainable places of play. Atlanta, Miami, Chicago, San Antonio, Los Angeles, San Francisco, hopefully Puerto Rico, and it will go on and on and on. The other thing that we've been doing is, in partnership with the National Foundation for Governors Fitness Councils, we've helped establish over 40 Live Positively fitness centers in public schools. Public schools across the country, where we know it's important to have those centers for active communities. And then we have a partner in this room. I want to recognize the National Hispanic Nurses Association. They have been leading the Muévete program with Coca-Cola, also focused on nutrition education and physical activity for Latinos throughout the country. And so these are just some of the things we're doing in partnership. There's many, many more in education and around women's empowerment and the Special Olympics and a lot of other programs. But I think it's also equally important that I talk about what we've been doing in terms of the entire beverage industry with, yes, our competitors, the Blue Bottle, PepsiCo, as well as Dr. Pepper Snapple. In 2006, in 2004, we entered into an initiative and an agreement with the Alliance for a Healthier Generation, which is part of the Clinton Global Initiative, and the American Beverage Association to adopt the school beverage guidelines. This initiative, which predates the First Lady's Let's Move, voluntarily removed all full-calorie beverages from primary and secondary schools. The use of the guidelines resulted in a 90% reduction in beverage calories between 2004 and the 2009 school years. So if you see the beverages in there, they're being bought in by the PTAs, because they're a great fundraiser. I hate to say this. That's how they're being bought in. It's not being bought in by our companies. And in 2009, you may have read this, the Healthy Weight Commitment Foundation pledged to reduce 1 trillion calories in the marketplace. In partnership with the food and beverage industry also, so it included companies like Nestle and Mars and Kellogg and Kraft, we pledged that we would remove those calories by introducing a lot more low-calorie, low-fat options and a lot more water into the marketplace. That initiative exceeded its goal, and we removed 6.4 trillion calories from the marketplace between 2009 and 2014. And if you go and read the evaluation on this particular research that came out of, it's one of the big schools did it. Their biggest complaint was they met it, they were following consumer trends. Well, if you want more healthy, lower calorie, no calorie options, we're gonna put it into the marketplace. So hopefully we're headed in the right place. The other commitment was to provide the transparent, factual, and understandable nutrition information on our products. So we really believe that clear and accessible calorie information on the front of packages makes it easier for people to make those decisions. So that's what I talked about before, about really driving it. But we also realized that that wasn't enough. We have products inside vending machines. So now if you go to our vending machines, you will see that there are calorie counts right on those vending machines. So before you choose, you will know the calories that you could potentially be consuming. And that's clear on calories. We know that that's not even, we need to do even more. So now we are going to be putting those calories on all of our fountain service machines as well. So whether you're menu boards, fountain service machines, if you're going to the movie theater, if you're going to a restaurant and you have a fountain service and you're gonna pick up that cup, you are going to know the calories in that cup without ice, maximum. And so we also, and this is very important for us, in October of this year, 2014, we went back to the Clinton Global Initiative and the Alliance for a Healthier Generation, and they worked on a new initiative, the Balanced Calories Initiative. This initiative is a big commitment by our industry. It's actually the biggest commitment that has been made by any industry. What the Balanced Calorie Initiative does is, it's a goal to help people reduce their beverage calories consumed per person nationally by 20% by 2025. We plan to achieve this by increasing access to smaller packages as well as mid, low, and no-calorie beverages. Some of you had an opportunity to taste Coca-Cola Life, which is a mid-calorie beverage. I personally like it. I think it's very crisp. And also increase consumption of water. We'll also drive greater calorie awareness with the labeling, and we're going to focus on communities where we believe we can have the greatest impact. That means working with communities to create interest in those options. So please stay tuned, NHMA. You will be hearing hopefully 2 to 3 model markets, 2 for sure, where the industry will be working very broadly and very deep for the next few months as we go into a test and learn environment. And we're also engaging moms and teens through consumer advertising and messaging. The last part is being done through Mixify, which is a national campaign. We're starting to help teens and their families balance what they eat, drink, and do to lead active, healthier lives. I think I have a Mixify. Where's Henry? Henry's so good to me. A Mixify commercial here that I would just like for you guys to see.
Balance isn't always easy. So Coke, Dr. Pepper, and Pepsi are joining your efforts to find balance with the new initiative called Mixify, coming together for the first time to talk to teens about balancing what they eat and drink with what they do, and helping them think about when they've had too much or maybe when it's time for a treat. Supporting your efforts with our message, balance what you eat and drink with what you do. That's how you Mixify.
Thank you. So, on a final note, I just want you to know we understand the importance of having options, and we're providing those choices. We also understand the importance of being part of the solution and being invested in our communities. The Coca-Cola Company is 128 years old, and it's a company that is totally embedded in every single community. We manufacture where we sell, unlike any other American company. And the importance of that, we manufacture in every single place where we sell, in every single country. The importance of that is for you to understand how seriously and how thoughtful we are on this issue, because we live with you. We're not bringing things from other places and serving them on your tables or in the restaurants or in your homes. We live with you, we go to school with you. We have over 70,000 employees in the US. And so we're committed to you. We're committed to this organization. And again, I thank you for giving me the opportunity to be able to share this information. And also thank you for having, the Coca-Cola Company in your homes and in your hearts. I know that you want us to do better, and you're challenging us to do better, and we will. Thank you so much.
Thank you, Lillian. It's terrific to hear about all of the initiatives that the Coca-Cola Company is undertaking. And I have to say that since Lillian has been there, I have really seen a tremendous focus, whether it's in magazines or in reading stories about this or in public service announcements, really underscoring every single initiative that Lillian just talked about. And I don't know if it's coincidence, but it really started happening when you went over to Coca-Cola. So thank you for everything that you do. Yes. I also just have to say that my household is a Coca-Cola household. Diet Coke, mostly. My kids call it Pica Pica because when they first tasted it when they were little, it fizzled on their tongue, and so it stayed Pica Pica in our household. So when you come over, we'll offer you some Pica Pica. So now I'm really excited to hear from our second speaker, Dr. Judith Flores. And just a very quick story. She wanted to become a doctora from the moment she was very, very little. And I hear that she wanted to become a pediatrician before she could even spell the word. So I'm really excited to hear from Dr. Flores.
Yeah, that was my mom's idea. And fortunately, we agreed. So I'm not going to spend much time speaking. I am a pediatrician in practice. I'm also do a great deal of hospital administration. So I think I bring a couple of things to the discussion. I am terribly sorry that I'm going to be talking about food choices and insecurity and obesity when we're eating. Usually not the best thing. This always happens to me. I gave a very good summary of food insecurity and obesity at an organization once, the same venue. Everybody was sitting down and having their lunch, after which they looked at me guiltily when they were pulling out their desserts, and it was not good. So I'm going to keep it brief. There's a couple of salient points, and one of them is that I would say that one of the biggest advantages that I've had as a physician and also an administrator is the partnerships. The partnerships that I've developed with agencies, organizations, policymakers that have educated me and given me resources to take care of patients and communities. One of the biggest partnerships that I've been involved in the last, I would say, 2 years was something thanks to Dr. Elena Rios and NHMA, who gave me an opportunity to be one of the fellows we started in 2013 in collaboration with W.K. Kellogg in addressing the issue of childhood obesity, especially among Hispanics. We know why we do this. We do this because almost a quarter of our children are obese. We love our gorditos and our gorditas, and we are also gordito. But we've decided to bash them. We decided that maybe it wasn't too good to be heavy, and maybe they needed to stop eating. And I have an unfortunate experience of when I take care of parents, having them come in and say, you know, my son, usually it's a boy, my son, unlike my other children and myself, is eating too much and obese. So we're doing a lot of that. And we're also doing a lot of that as providers of care. We didn't really know what we were doing. Maybe even 10 years ago, we were referring people to special obesity clinics and doing BMIs and doing clipping them for the amount of fat they had and all this lovely stuff that we do to children. So hopefully we're beyond that. So part of this Kellogg Foundation was really to sit down with partners in a variety of venues: government, childcare, educators, parents of young children. Listen to their voice. And that's one of the things that we got out of this. And it was very interesting to find out what their pressures were and what we were putting upon them. And in many cases, we were putting a lot upon the parents. They really didn't have the money to go out and buy this fruit and these vegetables. The mac and cheese boxes, I know, you can get 3 for good money. You can't do that with fruit. Fruit goes bad, the kids don't eat it, it goes bad in the refrigerator, it goes bad on the counter. It's an economic stress, so we're really kind of stressing a lot of people. And no surprise, the quarter of children that are Hispanic that are obese, quite a few of them are also impacted by poverty. They have poor access to health care. They have poor access to physical activity. They live in food deserts. You know what food desert is? That's when the supermarket around your house does not have what you're supposed to be eating. Or when you live in maybe a rural area and you have to take 3 buses to go buy the fruit that you had to put on the table. Needless to say, you may not have the money. So the opportunity that I had and that all of us had as fellows was really to look at this in a more structured way and try to work with other people and decide, well, what are the barriers, what are the gaps, and what policies can we support? What things can we support with our legislators? And this was primarily in California and New York, and push as 1 or 2 or 3 salient programs that will get us where we need to go. And where do we need to go? We really want to reduce the burden of childhood obesity on the family. It is a family problem. It is not Miguel or Maria's or Sean's problem. It's a family problem. One of the things I tell parents all the time is, do your children have an income? Do they have a salary? No. Do they do the shopping? No. So it really is a family, and we need to support our families. So this was great about the summit, that we did have the families, we did have the legislatures, we did have all those people at the table. So what did we come up with? Besides meeting 200 leaders and 2 different states, bi-coastally, sitting down and brainstorming this. Well, I think we came up with a couple of basic things. We came up with the issue that we need to go forward. This work needs to continue. We're not where we need to go. We need to educate ourselves and really start addressing the gaps that impact childhood obesity and obesity in America. We need to understand that this is a leverage point. This is an economic situation that affects all of us and affects this government. I'm so glad to hear the Surgeon General talk about these things. You can't run a hospital anymore because you can't afford it, and you can't afford it because everybody has diabetes, hypertension, heart disease, and dementia. And that's the outcome of what we're seeing in childhood obesity. So good things are things that the government, and I hate to say, CMS, are doing in terms of making us put our dollars into prevention, making us partner with our communities. And I do agree that we can partner with schools, we can partner with the housing department, we can partner with child protection. These are all people that have an impact on the families we take care of. So that's one thing that came out of that. The second thing is that there are programs out there that need support. The SNAP program, the school health programs are all under jeopardy. We have to realize that. They cost very little. I think someone told me that if I take $20 out of my pocket every year, average, and pay it into my income tax, that supports a SNAP program. That's kind of cheap. We can do that right now. That is what is threatened. So that's important to keep in mind, that sometimes that school meal, that school breakfast, that program is the meal of the day for some children. And you know that when you go shopping, if you don't have much money, you're going to buy the cheaper, more caloric-rich food that'll give you the energy to feed the children and fill your stomach. It's not going to be the piece of fruit. So we have to address that. The second thing was physical activity and having environments of physical activity. I agree that housing is very important. We have many places where we have housing that doesn't afford a safe, clean place for children to play and for parents to enjoy the outdoors. So that's important, to be creative about that. Can we retool schools on the weekends? Can we use gyms? Can we use other facilities? That's a local issue. That's something we can take back. So that was really lesson number 3. And lesson number 2. Number 3 again was that we have to be sensitive that we as healthcare providers need to educate ourselves. We need to continue to learn. We don't have the answers. People come to me and as a practitioner, and I don't have the answers. I work with them to see what's appropriate for their family and how I can learn more and bring more to the table. Resources are very important. I'm glad you spoke about the labeling. One of the things that I've had an opportunity to work with is one of the organizations is called Facts Up Front, and if you look at your labels on your food, you turn it around now, you can see the caloric value in front. It's voluntary, but we can start having our patients simply look at things, and it's sort of like spending your dollar. How do you spend your calories? So a lot of it is financial literacy, too. I'm not going to go on forever because you really need to enjoy your lunch, and maybe I will, too. And I'll be happy to answer questions, but remember, I will say thank you for the opportunity to be on this panel. I think the work has just begun. And thank you, Kellogg Foundation, for this opportunity for us to learn more and help our populations. Bye-bye.
Thank you so much, Dr. Flores. That was very informative. And I think what we've been able to get from the panel today is information that we can go back and really use and again, underscore the vital work that you all do each and every single day to give our families those informative choices, to be able to give them the tools to be able to make their own families healthier, and to understand that the power is in their hands and that you all are the ones that are giving them that power each and every single day. I also wanted to underscore something that for the last 2 years this is the third year, the last 2 years that I have had the honor to be here with you in one way, shape, or form, we have talked about the Affordable Care Act and how you all have been at the forefront of its implementation, of its education, and of making sure that everybody understood what this tool was and how it was going to make health care a little bit more accessible to our families. I'm sure you all have heard the numbers, but I think it really merits underscoring that right now more than 16.4 million people have affordable health coverage because of the ACA. And among the Latino community right now is enjoying the biggest numbers of people who now have insurance, and our numbers of uninsured are dropping more quickly than any other demographic. And so again, that is a huge testament to the work that you all do each and every single day. So another round of applause for you. Well, I think now we're getting ready to close out unless we have additional questions. Okay? You see Dr. Elena Rios at the microphone.
Yeah, Maria, thank you very much for bringing us all together. And I really want to just explain something about partnerships with NHMA on the lifestyle campaigns, that 3 of which we just heard about. Our Kellogg Foundation summits brought us to the realization that we had to make changes not only in New York and California as our targeted states, with the Latino caucuses of both states, but as Judy mentioned, we have found Hispanic physicians, and we're looking for more Hispanic health professionals to be the spokespersons for our efforts to decrease obesity in our communities through the media. We developed a national Latino media network to be able to do that. And then I want to say, in terms of working with Lillian, and we've talked about this over the years, we went beyond one company and said we need to get engaged with not only the Clinton Foundation that has been to this conference before, explaining the launch of the Healthier Generation program that happened in the schools in this country, but we have the American Beverage Association now as a member of our corporate advisory board. And it's thanks to people like Lillian and others who we know. And I have to say that the board of directors of Coca-Cola includes one of our CDC leaders, Helene Gayle, who I worked with when I was at HHS. And we're all trying to connect the dots on how NHMA can build the partnerships across this country. And with the U.S. Surgeon General, we have committed ourselves to work. We were with the Surgeon General's report on obesity. We were there at the launch, and we were there at the launch of the Let's Move campaign. And it's so important to realize that we will continue to work with the U.S. Surgeon General on the lifestyle campaigns that this luncheon so beautifully brought together. So I want to thank you all for a great job. Thank you.
Thank you, Dr. Rios. That concludes the lunch program for today. Please have a wonderful rest of your conference, a wonderful rest of your lunch. Buen provecho y muchísimas gracias.